I think you're on mute.
Yes, Charlie, you're on mute.
Hello. Welcome. We are the Magnificent Seven. Our group is using our voice to shape healthcare policy. This class is Healthcare Administration 780, and our group was tasked with identifying a state issue related to healthcare policy that we can. Oh,
Sorry.
I'm sorry. Can we stop it and start over? Or is there a way to edit this afterwards?
We've got 30 minutes, so like.
Just
Yeah, okay. We can start. We can restart,
Okay.
and just ignore the slide when it's green. So your driver, who's driving? I've already forgot who's driving.
Madeline's driving.
Madeline, you're driving wonderfully. Your driver is just going to change the slide while you're talking. Just ignore the driver and then look at the slide when she gets there.
I didn't mean to throw you off, Charlie. You were doing. You started talking about the team, so I was like, "Oh, let me move on."
All right, let's start. What's up? Okay.
Go ahead.
Hello, we are the Magnificent Seven, using our voice to shape healthcare policy. This is our group presentation for our Healthcare Administration Class 780, looking at healthcare policy. Our group, our members are, I'm so sorry, I'm terrible. Our team members, I can't talk right now. Y'all,
Start over.
terrible. I am so sorry. I know, it's like the last one here right now. Okay, I haven't finished writing notes. Can we just skip my section real quick and then circle back?
Let us help you write your notes, Charlie.
All right, I have introduction, group name, state issue, healthcare policy. Hello, we are the Magnificent Seven, using our voice to shape healthcare policy. Our team was assigned identifying a healthcare policy issue that we can address as a group, looking at various states and
different issues.
Different issues. Oh my God, y'all. I don't know why I'm farting so bad. I am so sorry.
Yeah. Yep.
Welcome to our presentation. We are the Magnificent Seven. We were tasked with finding a policy that we could either change or create to solve a problem in a state. So we decided to use our voice to shape healthcare policy in Texas. Our team is made up of a diverse group of men and women from all over the country with many different backgrounds, but most focusing in healthcare. We decided to work on a problem that we've heard about all over the news lately, which is opioid crisis, and we decided to focus in Texas. Specifically, when we decided to look at Medicaid expansion, we realized that that was much too broad a topic. So we decided to further narrow it down to Medicaid expansion to cover those in the opioid crisis. So those that are affected by opioids, including their family, their friends, providers, those prescribing opioids, etc. In Texas specifically, that negative impact not only affects the general health and welfare of Texas citizens, but it also affects the social and economic success of the state as a whole. If you just look at Houston, that area suffers from significant traffic, just being so close to the border, and a hub state for moving all sorts of illegal drugs, specifically opioids. Opioid is a true crisis in our entire country, specifically in Texas, though. In 2016, more than 1,300 people died of overdose-related deaths. So being that this was such a serious problem and one in the state of Texas, we decided to look at that issue and try and expand Medicaid to cover all of those affected by the opioid crisis, including those in treatment centers, prescriptive pharmaceuticals, etc. So here's
As far as the status quo, there currently is no mandate to cover addiction services in Texas, the state we chose to focus our efforts on. This becomes a problem because it leaves a huge question of how those patients are going to be able to afford care if they were to pursue treatment. Further, uninsured patients are likely to lack continuity in their care, and they face limited options to treat their substance abuse issues. We tend to see that patients without insurance end up overutilizing emergency rooms for their care needs, as they most likely don't have primary care physicians or someone to follow and monitor their care. This makes it really hard to maintain continuous care that would support overcoming addiction for these patients. Another recurring issue we see is that Medicaid only covers one medication-assisted treatment drug, making it difficult to utilize that treatment avenue, which is one that is well supported as far as evidence-based treatments.
The three evaluation criteria used for the status quo and alternatives are political acceptability, legality, and robustness and improbability. In order for an alternative to the status quo to be achievable, it has to be politically acceptable or at least not unacceptable. The alternative has to meet the legality criteria by not violating the constitutional, statutory, or common law rights, and it should be robust enough so that even if the implementation process does not go very smoothly, the policy outcomes will still be satisfactory. One of the main alternatives to our status quo is to expand Medicaid coverage in Texas to cover substance abuse treatments and treatment facilities to minimize the cost barrier to those individuals who are struggling with addiction. The proposed alternative would be politically acceptable because Texans are for Medicaid expansion, and they believe that through Medicaid expansion, there would be a happier and healthier Texas. Looking into legality, there are a lot of laws and rights that are ambiguous, but upon evaluation of the Texas Constitution, the Bill of Rights talks about equal rights and equality under the law. In regard to robustness and improbability, the alternative that is being suggested has the ability to be distorted through bureaucratic interest and diverge, but the outcomes will be satisfactory. Also, there's room for improvement without changing the end result, which is providing the citizens of Texas aid for treatment related to substance abuse. Another alternative to the status quo is the expansion of nonprofit supports in the community as a method of prevention for substance abusers. In regards to legality, the alternative enriches the Bill of Rights and does not explicitly violate any laws. The proposed alternative is politically accepted because it does not require the legislator to be pro-Medicaid expansion, and the alternative is both robust in the sense that even if the original proposal gets slightly distorted or diverged with other policies, the outcome will still be satisfactory because the citizens of Texas who need the help will still get the help for substance abuse. The alternative also has room to improve without losing the original purpose, making the alternative both robust and improbable.
Our team discussed 5 questions to ask each stakeholder, which is outlined below. We reached out to over 10 stakeholders, and the ones that responded back was a nurse administrator from La Hacienda Treatment Center, an opiate counselor at North Texas Behavioral Health Authority, a Methodist Healthcare Ministries worker, and a licensed counselor intern at Addiction Treatment Resources Counseling. We found a lot of similarities in the answers given, such as all the stakeholders were very concerned about the opioid use disorder. The nurse administrator spoke about the stigma around addiction and mental health, which is blocking federal assistance. All of our stakeholders are on the side of the clinical treatment of opiate addiction, but of course they were all in support of funding opiate use disorder. Our findings, we got a good feel on the impact of substance use disorder and how devastating that is to the Texas citizens. We also learned that substance use disorder has devastating impacts on families and communities and is responsible for huge costs in the state budget related to healthcare, public safety, criminal justice, homelessness, domestic violence, foster care, and social welfare programs. Healthcare facilities in Texas have significant financial limitations to their work with opiate patients. Most of the stakeholders did refer to this as an epidemic and that the consistency of care is lacking. Failed outreaches. We did try to reach out to law enforcement and public safety in Texas, but they responded with stating that they're not allowed to speak on the matter. We also tried to reach out to local economic community Texas Crisis Intervention Team, Al-Anon Corporate, Dallas Republican and Democratic representatives. We tried to reach out to these stakeholders by phone and by email. Our goal was to reach a stakeholder who possibly would not support Medicaid expansion concerning substance use disorder so that we could learn from their perspective as well. We learned a lot from successful attempts by team members on how to get stakeholders to respond, being persistent, possibly emailing the secretary, and allowing more lead time to let the stakeholders be able to respond. The learning we applied in the future, we learned in this class that when dealing with a policy issue, the stakeholders' perspective is central. When doing this project, we learned that stakeholders have a big role in shaping this project. It's been very insightful to read the answers from the stakeholders and see their perspective when it has been molded by real life experiences with the opiate epidemic in Texas. Okay, and that wraps it up for stakeholders.
Unmute Charlie.
Sorry. In order to stay the tide of this rising epidemic, the government must step in and protect the citizens of Texas through policy change. As of now, there is no mandate to cover addiction services for public and private insurance providers. The rising statistical relevance of the effects of untreated opioid addiction in Texas is startling, and something must be done. Through research, one can devise a variety of potential solutions to the problem. However, once evaluated based on political acceptability, legality, and robustness and improvability, the most effective solution would be to expand Medicaid coverage, specifically to cover more inclusively opioid addiction treatment programs, medications, and outpatient follow-up centers. This expansion would in turn help to shrink the cost barrier to those individuals who are most struggling with addiction but unable to afford help. Alternatively, should expansion of Medicaid coverage not be possible, one should seriously consider increased support of nonprofit organizations specifically targeting opioid addiction and treatment. An analysis of Texas stakeholders ranging from those suffering with addiction to treatment center administrators themselves found these alternatives reasonable as well as necessary. Mandating addiction treatment coverage from providers within the health insurance marketplace will most effectively aid in ending the opioid epidemic and begin repairing the damage that is done across the entire state of Texas. Thank you.
Good job. 9 minutes and 23 seconds.